This is One on One. One on One is honored to have Carl Kotowski, Special Agent in charge of the New Jersey Division of the DEA, which stands for?
Drug Enforcement Administration.
Carl, let me ask you. We were joking before we got in the air. People hear DEA. What happens?
Well, a lot of times, you know, they become a little standoffish because they're wondering, wow, what do they know about me? But
you don't mean me. I mean,
no, anyone in particular.
You can see how comfortable I am around you.
Exactly.
Yes,
exactly.
But people do hear DEA, and it means a lot.
It sure does. It sure does, because you know, our jobs as DEA special agents is to enforce the federal narcotic laws, and naturally, with different drugs such as marijuana, cocaine, you know, prescription drugs, all those are abused, and abused a lot. So you know, people at times get very uncomfortable.
You know, we are partnering with the folks at the American the American Medicine Chest Challenge. You'll see the website up there. We're trying to do everything we can to inform people about the seriousness of the abuse of prescription drugs. But we're going to talk about prescription drugs, talk about heroin, talk about synthetic drugs. Three huge problems.
Right.
Do the prescription drug thing first, and then we'll do heroin. How bad is the prescription drug problem?
Prescription drugs right now, nationwide, is probably the biggest drug problem, not only in the state of New Jersey, but throughout the country. It started probably back around 2007, 2008, where DEA recognized that a lot of people were abusing prescription drugs, primarily your pain pills. That would be your oxycodone, brand names such as Oxycontin, Vicodin, Percocet, even some of the antidepressants such as Xanax. And what it is prescription drugs gives a person the same effects as a heroin user. So you have a heroin addict, he or she cannot get a fix on heroin, then they turn to prescription drugs. One of the things that surprised everyone in law enforcement and also healthcare professionals was that for all of us, our homes were the source of supply for prescription drugs.
But here's the thing. The word epidemic is being used here, Carl. That's what's throwing me off. I mean, we did this thing on the American Medicine Chest Challenge. We went up to Hackensack University Hospital. It was it was a drug-free initiative where we were interviewing all these folks. The word epidemic's being thrown all over the place. I'm thinking, what makes an epidemic, and why is this an epidemic?
I think this is an epidemic because it's spread so rapidly. It just started, you know, the teens, young adults just trying it every once in a while. The word gets out, and before you know it, it's going from, you know, one small town to the next. And
social media has something to do with it.
Oh, it's phenomenal.
What does that have to do with it?
Well, the social media, just the fact that, you know, individuals are texting, Facebooking to their friends, hey, I just had some oxys, had this, I'm partying, we got some oxys. You know, the big things with high school and college students right now, Steve, is they call them either Skittle parties.
Skittle parties?
Or farming parties, as in pharmaceutical. And what it is you know, the kids come to a party, they have a handful of prescription drugs. It doesn't really matter which type.
Yeah.
They throw it in a bowl, and then they spend the night just swallowing pills and drinking alcohol.
Do they even know what they're taking?
Not at all.
Well, where are they getting this stuff, Carl? That's what I'm not getting.
And that's the thing, they're getting it from the home. That's the biggest source of supply for prescription drugs. So it starts at the house. It's all of the expired, unused prescription drugs that are in the medicine cabinet, the ones that we don't need. That's why DEA and a lot of the police agencies right now in the state of New Jersey participate in take-back initiatives.
Let's go through this.
Sure.
There's a couple that are really important. By the way, the website's up. Natalie, is the website, okay, thank you very much. Let's keep that website up because this is important. We'll bring some information to you, but the websites that we have up are there to give you much more information so you can act on it. We're talking about some initiatives that help people get what they need. The first one you talked about is?
The National Take Back Initiative.
Take back what and where? How does this work?
The Take Back Initiative started by DEA back in 2010. We had our very first one, and basically it's an opportunity for people to get rid of, anonymously get rid of their expired and unused prescription drugs in the home. Okay.
I'll give you an example.
Sure.
Surgery a while back, I do have I don't have a problem saying this on the air. I have some oxycodone left.
Right.
Probably 7 or 8 pills. Why? Because the pain stopped.
Sure.
But I kept it around, frankly, because I was thinking if, in fact, the pain came back, I would have it. Is that a mistake?
Yes, it is.
It is a mistake.
It is. If you're not using it anymore, you should get rid of it. Because just you alone saying that I have oxycodone at my home, if someone knows where you live, hey, wow. You know,
the camera guys are laughing. I should not have told you that?
Well, no, but I mean, that's the concern.
Is that common?
That's common. So is people jumping into dumpsters, going through trash, looking for unused pills.
But let's go back.
Sure.
If I'm going to do the right thing, if we go back to the take-back thing, Natalie, do that. If I'm going to do the right thing with that oxycodone, I want to use myself because I don't think I'm alone here.
Okay.
To do the right thing means I take it and do what?
Okay, this is what you do. You can do it 2 different ways. Luckily, in the state of New Jersey, which is very nice, they have what's called Project Medicine Drop.
Project Medicine Drop.
Project Medicine Drop. It's sponsored by the New Jersey Division of Consumer Affairs.
Got it.
And you can find all the information on their website, okay? But what it is, it's an offshoot of the DEA Take Back. And what Project Medicine Drop involves, there are 73 police agencies right now in the state of New Jersey that will take back any unused, expired prescription drugs 24/7.
What do you do? You just bring it in?
You bring it in. There's no questions asked.
What about, aren't they going to ask me out of bottle? What were you doing with the...
No, not at all. Not at all. It's all anonymous, Steve. There's no questions asked. They bring it in. You just drop it in a container, a locked container. It has to be in a police department, a police office, a district, because naturally you don't want abusers going in, sticking their hand in the box and taking out. And then twice during the year, DEA sponsors its nationwide National Take Back Initiative.
Got it.
We will be having our 8th one April the 26th of 2014.
Yep.
In conjunction with all our law enforcement partners in the state as well as throughout the country.
By the way, real quick, before we go to heroin, someone runs out of, in my case is one, the other case is you run out. What happens? What are people doing?
I'm sorry,
They run out of the prescription drugs. They start scrambling.
Oh, no, they should be going back to their doctor and seeing their doctor.
And if their doctor says no, some of these people, that's when they're going out looking for, right?
That's when they're going out looking for. That's where they're either checking online, talking to friends, hey, where can I get some oxys? Right now, oxys are the most popular, whether it's in this state or anywhere else. It's a 30-milligram tablet of oxy, 1 tablet, $30.
1 tablet, $30, but the heroin, cheaper?
Oh, much cheaper. $5 to $6 on the street right now.
How much?
$5 to $6 for a bag of heroin.
Is that why heroin is becoming more of a problem?
That's it. This is what happened. About 8 to 12 months ago in New Jersey, but also nationwide, this is a nationwide trend, we, DEA, we started to see a trend where due to the crackdown on prescription drug abuse, people were thinking, wow, I cannot get my oxys, I cannot get my Percocet, my Xanax as easy as before. Law enforcement's cracking down, healthcare officials. So what they're doing, why spend the $30 for 1 tablet? I can go out on the street, get a bag of heroin for $5 or $6. It's the same physiological effect. So that in itself also increased the popularity of heroin in the state and increased the number of users.
And finally, give me 1 minute on the synthetic drug issue.
Synthetic drugs. 2 different types. It's really an FYI for the parents. You have synthetic marijuana, synthetic cocaine. When you hear the word synthetic, what you have to remember, it's man-made. It's not naturally produced.
And don't let people think, hey, not big deal, because it's synthetic, it's worse.
It's huge. A lot of fatalities. Anytime you take synthetic marijuana, synthetic cocaine, people experience suicidal thoughts, hallucinations.
Cheaper?
Not necessarily.
Okay,
not necessarily, but it's very dangerous. Very dangerous.
People, if they're hallucinating, God knows what they're going to do.
I've had reports, I've read reports throughout the United States. People take it, whether it's K2 spice, which is synthetic marijuana, bath salt, synthetic cocaine. They think people are outside their home. They start, if they have a gun in the house, they start shooting through the window, sledgehammer to their walls because they think people are inside their walls, tearing up their skin because there's something in their skin. It's terrible.
Special Agent in Charge, the New Jersey Division of the DEA, Carl Kotowski, we have scratched the surface, but throughout this segment, as part of our public service, you've seen the information up of several websites. Your job is to go on those websites. Parents, others who are concerned, get more information. Carl, I promise it will not be the last time that we explore these issues with you. I know we've just scratched the surface, but thank you for all the work that you've been doing for nearly 30 years on behalf of the citizens of this nation.
Thank you very much.
Thank
you. It was
you.
a pleasure.
We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by activists in cooperation with the American Medicine Chest Challenge, Choose New Jersey, NJIT, Health Republic Insurance of New Jersey, the New Jersey Education Association, Berkeley College, and by the Healthcare Foundation of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.